Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined this evening by Valentina. Valentina, please introduce yourself.
Hello there. I am Valentina Vasquez. I am a current administrative fellow at Children's Mercy Kansas City. My fellowship is a 1 year program, and I'm about 8 months in. I started in July, and it's been a great experience so far. And I'm kind of in the midst right now of figuring out what comes after a fellowship.
So happy to have you on, and it's such an exciting time for you. Going back to the very beginning of your career or your educational career, you got a bachelor's in public health and then you got your MHA. Why did you not get an MPH? Why instead did you get an MHA?
Yeah, for sure. So I got my public health degree in the midst of the pandemic. So my junior year, the COVID-19 pandemic started, and I transitioned fully online for the end of my time at the University of Oklahoma. So I moved back in with my parents. I got my practicum with the Oklahoma State Department of Health, and while I was working with them, I gained a lot of public health experience, of course, and strategy experience. And one of the things that I learned is, especially while you're young, you have so many ideas and you want to continually innovate. It can be difficult to do so in an environment where maybe that isn't appreciated as much, or there are a lot of barriers and red tape in order to accomplish a lot of the goals that you have. So instead of continuing in kind of the public health realm and working for the state, I decided that I wanted to transition and go back to being fully focused on hospital work, because my original intention when I went to college was to be a doctor and to be some sort of pediatrician, but that did not end up working out. So I transitioned to public health my sophomore year. Junior year, the pandemic started. And then by my senior year, had pretty much decided that I was going to transition to more of the hospital administration side of things.
That makes sense, and that is a very familiar story. It's actually similar to myself. It was first pre med, and I've switched around a bunch of times, but that public health was kind of the next step, and then that meshing of public health and the actual operations is where I kind of found my home. So I get where you're coming from there. Now, one of the questions I have is you mentioned that when you went in, you wanted to be a pediatrician. So where did that interest in children's healthcare start?
Yeah, for sure. So I am an older sister, and that is one of the pillars of my character that I hold very strongly and very dearly in my heart. I watched my little sister grow up. She's 4 years younger than me, but I still remember when she was born, I would go to all of her, first appointments. And the doctor that she had was so great. And she involved me in the appointment. So I got to listen to my little sister's heart. I got to look into her ears. And we would talk about, how a baby was developing. And from a very, very young age, she instilled that passion in me. And growing up, I always loved being around kids. And then actually during the pandemic, I was able to nanny two twins who both had speech and hearing issues as well as vision issues. And getting to see how their family navigated through the healthcare system also was one of the things that pushed me to be on the hospital administration side, because I know that helping families is really a pillar of what we do as administrators, as well as helping the physician.
Absolutely. Wonderful experiences that you had. And then you got an internship, an administrative internship at St. Jude. Was it challenging to get that internship? And how specific were you in applying for internships? Did you only look for those at children's hospitals?
No, actually, the first one that I applied to was probably about 2 months before I applied for the St. Jude one. It was with an adult health system. I went out and did my interview in person with them, and I realized pretty quickly that that wasn't the environment that I wanted to be in. Not just because it was an adult hospital, but I think the way that their executive team worked together was just something that I wouldn't have meshed well with. So decided not to take that internship. 2 months later, I was actually doing research on administrative fellowships for my graduate research assistantship. And I was literally looking at a list of all the hospitals in the US and typing their name and then administrative fellowship. and I got to St. Jude Children's Research Hospital Administrative Fellowship, and their administrative internship came up. And I think I had about 3 weeks to put my application together. And thankfully, my program was super supportive. My professors were able to write letters of recommendation for me, and I was able to get that submitted. And then they have a very seamless process. They review all their applications, and then about mid-January, they start doing interviews. And it was an hour-long interview. The first 30 minutes was with their strategy team, and the second 30 minutes was with their finance team. There was about 3 to 4 people on each of those calls. The questions that they asked were very introductory and, very basic level interview questions, knowing that we were graduate students and probably incredibly nervous. So I felt really confident. I think one of the best parts about my story and kind of how I've been able to develop professionally is that I've had so many great storytelling moments in my life, and I'm really able to encapsulate that when I'm having interviews and talking to different people. So I made sure that I was really prepared for that interview, and it went great. I think I loved getting to learn from them as well, because I think that's a really key part of an interview, is making sure that you ask them questions and do research on them. And they are one of the institutions that posts their strategic plan. So I was able to go through and actually read all the pillars of their strategic plan and ask specific questions about that, which then in turn, once I got the internship, a lot of my projects stemmed from the questions that I asked in that interview.
Mm. So interviewing is a skill that and that is one of the unique ones. I haven't heard that mentioned too often, and that's great that you mentioned it. Interviewing is a skill that you've worked on a lot and that you're very good at, and that's where you've been able to see success. So that, I think, is excellent advice, is to focus on telling your story. And there are
Definitely.
so many people with amazing stories that I've talked to as well. So that's excellent. I wanted to ask, you mentioned that you didn't think you'd mesh well with that first team. How do you identify people who you do mesh well with? It's challenging to do that for myself when I'm early in the career. Sometimes I just kind of, do whatever works is what I go with. But you're saying that, you have an established vision that you were looking for. Can you explain what that was like?
Yeah, and I'll actually give you like the specific example of what I use in interviews to kind of define that for myself. So
Excellent.
at the very end of every interview that I have, I ask the interviewer if they have any hesitations for me being the most qualified candidate that they've interviewed for that position. And that not only puts them on the spot, because they have to like think of what they're going to say and like what are they going to say to this this poor girl that's applying for this position, but it tells me very quickly, are they able to be candid with me, are they able to give me real in time feedback to how I'm interviewing, how I'm answering questions, my experiences, how I'm fitting into the expectation that they have in their head for this position. And if they're able to be candid and give that feedback without, all the fluff pieces of wording that we add to try to make people feel better, I feel very comfortable with that. And there may be people that don't feel comfortable with that and may not be able to ask a question that bold, but I have seen literally firsthand, asking that question starts a mentorship relationship where I'm able to come to that person vulnerably and get real feedback from them, with them knowing that I'm just trying to learn, I'm trying to grow as a professional. And it's something that really matters to me, is that I have their trust and their confidence and their candidness.
That is really important. How did why are you good at handling that? How do you handle that so well?
I think the majority of the responses that I've gotten stem from misconceptions about something that I said during the interview.
Hmm.
So it actually gives me the opportunity to clarify what I actually meant, what my point actually was. And then in turn, we're able to have another conversation on something that really matters to them, because I know it stood out to them. So I don't know. It's worked out so far. Maybe sometime I'm going to get my feelings hurt and I'm never going to ask that question again, but it's worked out for me so far.
I think maybe because you're a humble individual, that helps. I remember mine. It was interesting because it was like somebody said that it looks like all I wanted to do is work in insurance. And I was like, I don't only want to work. So I went and edited my resume again. And then this past one, somebody said I jump around roles too much, but I had the same company, just I got promoted. So it's like, I need to fix this so it doesn't look like bad, but it was critical advice. And I was like, wow, I really need to fix that. It is impressive, I guess, the level of, humility that you're able to cultivate. And I think that that's an important thing for people who are going into the MHA program, because I have spoken to people who are even older, they're in their 40s, and that humility has helped them out a lot. Even though they're
Mhm.
40 years old or 35 years old, they still act like they're brand new to things. And I think that's something that it kind of shows that, you have that, and you've been able to take that criticism and then turn it into mentorship relationships. That's incredible.
Yeah, I love that, Cole. And to add just one more thing, tying this
Please.
back to administrative fellowships, asking a question like that shows to the interviewer that you are somebody who is willing to learn from your
Mm.
mistakes, willing to learn from, maybe gaps in experience that you have. That is something that is key to an administrative fellow, being able to acknowledge that you don't know everything, that you're not, this perfect human being that's going to come in and change that executive team's entire perspective on the world. That's not the case, right? So being able to be humble and come into that scenario saying, I want to learn, I'm just trying to grow professionally, I think is a key point to being an administrative fellow applicant.
I hope I can learn how to navigate that before grad school's over and before I start applying for those. So maybe something to bring up with my therapist for sure. That does seem very important. And so after you did this internship for 4 months, right? 4 or 5 months or so, and then
3 months.
3 months. Oh, okay, three
Yeah.
months. Okay, nice. So not that long though, but it seems like you, based on the description I read on LinkedIn, you did a lot while you were there. Very impactful.
Yeah, it was incredible. I will talk about my experience at St. Jude for the rest of my life because it really was the best experience I could have asked for as an administrative intern. So going in, they don't have an administrative fellowship program. So they treat their interns what I would consider a lot of health systems treat their administrative fellows. So we were given, top level exposure from day one. I mean, I'm not kidding. I got my badge, and an hour later, I was on a call for one of the most important projects I worked on the entire summer, and I was like, "Oh my goodness! Like this is hit the ground running. I'm so excited to be here." And I think, yeah, I was only there for 12 weeks, but I was able to work on about 10 different projects, both incredibly hands-on and some just being able to shadow what the project was doing and kind of looking through the project charter. But yeah, I think also the other part of my experience at St. Jude that I want to speak about is being able to work with leaders that are willing to teach you and coach you in real time on how to do a lot of the things that you only know conceptually from class but want to be as helpful with in actual practice. So like one of the projects I got to work on was a community health needs assessment, which I had experience on because I was a public health undergraduate student and got to kind of see that process along. But going in and actually creating pillars and having conversations with large groups and having to condense information is something that you need to really work on in person. So getting to do that was incredible. And then one of my favorite projects that I worked on at St. Jude was actually a security project for their facility master plan. I really just got to interview with the security team. They hired consultants to come in and kind of do an evaluation of all of the security features at St. Jude, and getting to follow that process along has made me look at buildings and hospitals in a completely different way since that day. So, yeah.
So if we go back again, the bachelor's in public health, you had that practical experience with Oklahoma State Department of Health. You have this incredible administrative internship, and then you get your MHA, and then you start the fellowship.
Mm-hmm.
With this fellowship, was it really hard? Was it drastically different from everything you've done? Or were you like very prepared and able to handle things, or somewhere in between? What was that like?
I think coming in, I had an incredibly long summer before I started the administrative fellowship. So I graduated from my MHA program at OU. A week later, I got married, and then I spent about 3 weeks on both my honeymoon and a family vacation. I moved
Oh, wow.
states. And then I went to the Taylor Swift concert over the
Oh,
summer,
nice.
and literally 2 days later, I started working as the administrative fellow. So
Wow.
I came in kind of needing a break from my hectic home life and really the structure of my job. And one of the reasons I feel like my experience at Children's Mercy has been so great is because we are given so much autonomy in what we're able to do. Our entire fellowship structure really is dependent on us and what we're wanting it to be. So I was able to sit at the beginning of the year with a list of all of our departments and outline how much time I was going to spend in each area, what the key pillars I wanted to get out of those areas were, and then start meeting all the leaders that I'd be interacting with for the year. So that's kind of the structure of our fellowship is it's more rotation based and the projects come along with the mentorship relationships that you build.
Wonderful. That is sounds like an incredible experience, and so does your summer. That's I'm actually jealous of the Taylor Swift concert there. So it sounds like an amazing fellowship program. What were your favorite rotations that you've done so far?
Yeah, oh my goodness. I've had so many incredible experiences everywhere that I've gone. So, just to give you the scale, we do about 70 rotations through the year. Right now, I'm in mid 60s, so I'm almost done. I'll be done hopefully by the first week of April. And my favorite one so far has been with our critical care transport team. I think this is back in August, maybe early September. I was able to go out with our critical care transport team to pick up a patient in our helicopter. And before we even started the day, I really had so many questions around the mental health impact of the role that they play for our hospital because they see the highest acuity of patients that we have. And we were able to have such a meaningful conversation about the support system that we have at Children's Mercy, the support system that they have for their own team, and kind of all of the experience that they've had in their career, because I was with people that have been in critical care transport roles for almost over 30 years. And I felt so good about the conversation that we had had. And of course they talked about the hardships that they have to face in being able to do their job. And but they felt so good and they love what they do. And I remember one of the people that I was shadowing with that day said, I would never do anything else in my life. Like, I will retire from this position. I love my job so much. And so we started off the day, we get on the helicopter, we go pick up that patient, and it was a patient who was end of life, and we were bringing her to Children's Mercy for end of life care. And it was incredibly difficult to have that conversation with the parents of, we have to take your kiddo about 2.5 hours from where you live to start the process for, hospice care. And they were so brave the entire time. And I was holding back tears talking to this dad who was crying because his little girl had never flown before and this was going to be her first time flying. And our team was so supportive and were able to immediately connect with the family to make sure that they felt safe in the decision that they were making. And when we got back to the hospital, we transferred that patient off to our PICU team, which everything went so well, and we were able to kind of debrief in the hallway. And they were saying to me that these are the hard days, the days where you've done everything you can and you know that you've brought them to the absolute best place for care, but you can't save every single little kid that we see. And that, it really makes an impact on you, especially on the administrative side, to make sure that you're doing everything in your power for our frontline workers to have the best experiences in their roles, to feel the most supported in their roles, and to make sure that they feel like when they're out there doing their job, there's somebody back at home or at the hospital that's looking out for them and doing everything possible for them to be successful. So
Wow.
that has been by far my greatest experience. I've also had great experiences elsewhere. I have learned how to clean a room and disinfect it properly with our EVS team. I've learned all about food regulation in our cafeteria, which I was fascinated by. I realized when I showed up for my food services rotation that I'd never been in a public kitchen where food is created for a lot of people, and I got to learn so much that day. I spent time in our NICU, in our PICU, and our CICU. I've gone out to our clinics and visited with several nurse managers. I've had an incredible year so far, and I say every rotation brings its own hardships and also its own lessons. So I've felt great this year.
I've never really heard a fellowship experience quite like that. So that's inspiring. And in the 60 rotations, you said, right? That is
70 rotations.
70. Unbelievable. That is a tremendous amount. So that's a little over like 1.25 a week, right?
Yeah, so I we have it split right now into two different sections. There's core rotations and then exploratory rotations. So your core rotations are more of hospital operations, clinic care rotations, and then you transition to exploratory, which is more of the business side of the hospital. So when I was doing my core rotations, there were several days where I was doing more than one, and even coming in on the weekends to see our weekend team and see how they operate. So for our spiritual services team, I got to come in on the weekend to see how they take care of things while the rest of their team is out and it's only one person. So
So you really have a good grasp of every pretty much department.
yeah, definitely. I don't think that there's a single leader I haven't met. Maybe on the research side, I haven't met everybody, but definitely on the hospital side, hospital operations side, and clinical care side, I think I've met just about every administrative leader.
So do you think you want to stay with the same institution, or do you want to move to a different area? What is that looking like for you?
Yeah, definitely. But I'm a tremendous homebody, and I've actually grown worse the older that I've gotten. I grew up most of my life in Tulsa, Oklahoma, and that's where my parents are right now, and where my husband's family is as well. And I think as much fun and as many incredible experiences as I've had at Children's Mercy, I think I'll be transitioning back home here soon, and by the end of June, early July. Although, that's not crystal clear just yet how that'll end up. We still have several months and several weeks left to make a final decision, but I would be more than excited to stay with Children's Mercy, especially it being an independent children's hospital, which is something that matters so much to me when we're talking about strategic planning and we're talking about the way that the hospital functions. It's been great to have that experience and to add that to my resume, but yeah, I think my heart is back in Oklahoma, and that is funny for me to say because I've lived on both coasts. I moved to Memphis for the summer that I got to work for St. Jude. I've lived in South America and in Central America, and somehow my heart belongs to Tulsa, Oklahoma. So
So we could pick up the hospital and plop it over in Tulsa.
that would be the dream. I would love to pick up Children's Mercy and drop it in Tulsa, Oklahoma.
What do you like about Tulsa?
Oh my goodness. No, I moved to Tulsa when I was 10 years old, so 2010, and I've really gotten to see the city grow into something completely different than when I was there. I mean, downtown has been fully reconfigured in the last 10 years, 15 years. And also, my parents live out in the suburbs, and the area that we grew up in is so different. It has grown so much. But I think really like I'm gonna say it. I think Oklahoma's the South, but like the Southern hospitality of everybody that you meet in Oklahoma and the neighbors that you have is something that I really truly appreciate, and it's something that I missed. I think also like just again going back to being a homebody, like I miss the restaurants that I grew up going to. I miss the church that I grew up going to. So yeah, I think that's something that's drawing me back.
Well, thanks for coming on and sharing this all with us, Valentina. I couldn't be more appreciative. I know we stayed later than we usually do, but I appreciate you being so accommodating and joining us to share your story.
Thank you, Cole. I appreciate you reaching out, and I'm happy to help anyone that's interested in pursuing an administrative fellowship.